Hey there, how's it going? Naota Hashimoto, Dr. Hashimoto here. I'm here with 3D Practice, Robert Rocha. He's an engineer that has been helping chiropractors explain what they do. And I have a number of clients that use you, and they said that I have to talk to you, which is kind of like how we started. And I know you told me earlier when we were chatting, but can you just tell us a little bit about yourself and how you kind of fell into this other business?
Yeah, you bet. And thanks for having me here today, by the way, Noda. I started out as an engineer, and I think at my core, I'm very much an engineer, and my wife would certainly agree with that as well, too. But I started out my professional career as a biomedical engineer, and here in Tampa, Florida, and I did that for a number of years. And I actually got my master's degree in electrical engineering as well from the University of South Florida. And went on after that to Motorola down in South Florida, where we were creating cell phone technology, basically. So we were writing software for cell phones. And if you remember the Nextel push to talk cell phone back in the day, that was our device. We wrote software for that. And so I worked there at Motorola for about 4 years. And I did really love that combination of engineering and healthcare. But, this was totally different now. Motorola, super geeky stuff. And I wanted to, after we kind of finished that last development cycle, I was a little bit burned out on it. I wanted to go off and do something different. I wanted to get into sales. So I joined a company. I was a technical sales guy for about 4 years with one company. And then I joined another company after that and did business development before starting my own little business. And my business was engineering services, which was great for a little while. And I pulled in a bunch of the engineers that I met and got to know over the years, and we just kind of had a little bit of an ad hoc-ish team. So it was very eye-opening, but we were super busy. It was a great time for it, at least for a little while. And when the market changed and I lost some customers, I had to pivot, look for something else to do. And I got introduced to chiropractic care. I realized there wasn't anything great at the time that I thought was available for doctors in the way of patient education. And honestly, there was concepts I didn't really understand as well. So I went ahead and created a little something. I connected up with a practice management group. We sold a lot of it. It was very well received. I couldn't believe the feedback that I was getting from doctors that were using it in front of their patients. And that's how 3D practice started.
Huh. So for like some of the people that are on here, like they might be using like a model or a poster,
Right.
and I'm assuming like you can't have a ton of different posters and you can't have a ton of different models sitting in your room. Like, what would you say to someone that says, "Hey, what about my poster? I got my poster."
Yeah. Well, I think when you think about what a patient would have access to, so that the patient can go online and get all kinds of great information and graphical based information about their conditions and treatments, stuff like that. So when they're visiting the doctor, and if the doctor's pulling out that paper chart or that plastic model, it's probably not making them look really good. The other thing I would say too is that I think the doctors have to really present things in a pretty compelling manner as well if they're going to have that patient going forward with care. And you think about it, and it's no surprise to anybody that the reimbursements for the doctors are going down, and that's across a lot of specialties, not just chiropractic. But then also premiums for the patients are going up at the same time. So the patients, they show up at the doctor's office, at the chiropractor's office, say, "Look, I've got low back pain. You helped my friend out who had low back pain. I've got my insurance card. What can we do here?" And the doctor's going, "Well, insurance is only going to pay for a part of that, or we're not taking insurance anymore." So there's that chasm, that divide between the doctor and the patient that has to be resolved in some way. And I think that's kind of where our product comes in as well, too, because now the doctor can say, "Let's just take a step back. Let's take a look at what's going on here. Okay, let me show you. This, after my examination, is what I think your condition is, right? And this, let me show you, these are the reasons why you have the symptoms you have, the numbness and tingling, the muscle spasm, the pain that's traveling down one or both legs, or whatever it is. And by the way, this is the solution. Let me show you that." So it's a much more compelling way. And given that gap, that chasm between the doctor and the patient, and what the patient needs and wants, and what the doctor needs and wants, I think it kind of bridges that gap between.
It does, and I've always said, like, if they don't understand it, they can't buy it. And then sometimes that maybe the spouse isn't there being able to give them something that they could explain to their spouse because they go home is like, I gotta pay how much for
Right,
what? I was
right,
like, so it's like that part kind of makes sense. But like, I'd tell them, I'd show them. I didn't try to teach them anatomy, but like just
right.
show them like some kind of
Doesn't
like
have to
big
be.
picture concepts. And
Right.
like studies show that actually treatment plan compliance will improve if
Right.
they understand it. And,
Right.
like I did teach back method, like, get them to explain what I asked them. And,
Right.
like it's just, like I have kids and like you got to tell them over and over in
Right.
multiple ways. And I think I
Right.
had to tell them to brush their teeth before they go to bed,
Right.
like 1,000 times before they started doing it. And then, yeah,
Right.
like I remember my younger son, he was sleeping over at some baseball friends' houses, and the parents were like saying how well behaved he was because he told all his friends, "Hey, you guys gotta go brush your teeth. We ate this
Right.
candy over here. We had cake. You gotta go brush your teeth." And it's just because we told them 1,000 times.
Right.
But I think if you could tell them multiple ways, I think people are very visual.
Right. And
So,
it doesn't require a lot of time. I think it's more just concise, get to it and say, look, here's where you are. Here's where you should be. Here's where you are. Here's where you're going without the proper care. A little something there. Maybe there's symptoms. Here's the solution. Kind of keep it
eh,
concise. If they come in with an MRI, you want something to show them that looks like an MRI.
so getting to this, and I know it's pretty easy. I'm not gonna pick on any of my clients, but like I know, like like a couple of the people I know that use your software, I wouldn't say that they're tech wizards, right? So
Right.
like I'm assuming it's relatively easy for them to pull up, right?
Right.
And they could just there's like some kind of like web-based app that they just log in and they just
That's right.
search a condition and pull it
Right.
up.
That's the key because you can have the best animations in the world. You can brag about all the thousands of videos and this, that, and the other and the capability. But guess what? If the doctor logs in or the staff member logs in and it's difficult to understand what's in front of them and how to navigate through it and use it effectively, especially in a report of findings setting, guess what? They're not going to use it anymore. So that's the key. That's, you want to have all that powerful content. You want to present it in a way that the patient can understand, but you also want to make it super easy and intuitive for the staff as well, too. And every conversation I have with a doctor is valuable because I am listening for, where are they getting hung up? Is there something that's missing? But getting that user interface is something I'm totally keyed into and getting that right and making it easy for them to
And
use.
then you have a lot of models in there. Like the guys I know do spinal decompression, but I'm assuming
Yeah.
like they're if there's like like how many things do you have? And obviously you keep
Yeah.
adding new educational pieces. And what are some of the popular things that your clients use?
Yeah, decompression's a big one. Every time I hear when I do a demo or I talk to somebody when they say spinal decompression, I know it's a great fit for them. If they didn't use anything else, if they didn't use the care plan or the exercise plan generator or any of the other stuff for marketing and practice, I know it's going to help them move those patients forward to care. Patients are going to see the value of decompression therapy. Yeah, and then
Regenerative
so there's
medicine,
a
like any
pardon
people that do like stem cells, regenerative
Yeah, yeah.
medicine, things like that.
So the stem cell stuff, we're going to put that sort of thing, regenerative medicine, back in there. We've done stem cell, we do services a while back, and we've created a lot of stem cell videos for clients as well, too. So we're going to add some regenerative medicine in there. There is regenerative medicine treatments that they can check off that go into the care plan already. But as far as creating some animations, where, the actual process of inserting the stem cells and stuff like that, or the regenerative medicine, we're going to go through some animations and update that here pretty soon. But whether they're using shockwave or laser therapy or corrective care, upper cervical or flexion distraction, whatever it is, CBP, we've got content for just about everything you can think of.
So would you say that people sign up more for explanation of conditions or explanation of treatments? Or is it both?
I would say,
Because
I'd,
I gotta imagine that they're doing
right.
both of those things.
We have all that in there. So pretty much any condition you can think of, spinal conditions, extremity conditions, they're going to be in there, right? But we also have a lot of doctors ring us up and sit down and do a demo with us because they've got this expensive shockwave device. Maybe they spent $40,000 or something, or a decompression table, it was 100,000. They got to be able to explain the benefits and how this stuff works and move those patients forward to care. So a lot of times that's where it starts. They have this expensive device, they're charging cash for it, and they need something to help them explain it to the patients.
Cool. And then I remember you gave me the demo and you're showing me like AI treatment plan, the stuff that you're integrating in there. Can you tell us a little bit more about that?
Yeah. Yeah, I think we did a really good job with the treatment plan. We had an earlier cloud version about 4.5 years ago. Actually, we just replaced that with a new one a month ago. So this brand new version's out there. Doctors seem to be loving it. We're very happy with it. But it has a care plan that has some AI functionality built in, and AI service as well to help us really kind of generate some really good content and do it quickly and even put it in whatever language they want as well too. And we took this approach where, again, it's that whole graphical user interface has to be very simple, very easy for them to use. So just like when you go to like Amazon, if you want to buy like a pair of shoes on Amazon, there's these filters on the left-hand side, and you can select what content you want to actually look for or shop for. So it's same sort of thing. There's these check boxes on the left. So if they want the phases of care in there, guess what? They can check that off. If they want the listing of all the treatments that are applicable to that condition, they can check that off. If they want lifestyle tips or they want peer-reviewed studies for each one of those treatments, they check that off. Or a good faith estimate. So whatever it is, and then they just simply go through the plan and check off. So when they check off shockwave therapy or decompression or dry needling or whatever it is, they can also say, I also want the peer-reviewed studies. So they're going to be peer-reviewed studies with positive therapeutic outcomes. So that plan can be pretty high level for the patient to understand. But for that patient that's like my wife, that's going to read every letter and every peer-reviewed study on there, before she says, we can go down to that level of detail as well too. So the feedback's great. We're always looking for more feedback, and it's general enough or customizable enough, I should say, for doctors, whether you're a chiropractic neurologist or you're just doing decompression or shockwave is your big thing or corrective care, whatever it is,
And you showed me
it
you
works.
had like favorites, right? You could have your favorite treatment plans where it's like kind of pre-built too.
Yeah. So once you go through and you create it for that particular condition, it's built, right? All you have to do is select it. If you want to change the language from English to Spanish to French, whatever it is, you can do that. It'll quickly just, the AI service will go ahead and rebuild it. And then you can text or email that directly over to patients as well, too.
Yeah, I was chuckling earlier how you used the Amazon as an analogy for filters because I've always used that one because like
I'd
I
never heard you.
explain
Yeah, that's
filters
interesting.
and it's like I was
Yeah.
like, oh, you
But
don't get it. It's like, you're buying a pair
yeah,
of shoes on Amazon.
yeah,
So I was like,
yeah.
it's kind of funny I use the exact same analogy.
You got to think about what's familiar to,
Yeah.
the doctor, the staff, the patients, and let's kind of, leverage that sometimes.
Yeah, absolutely. And then I know you have like some big grand plans of some of the stuff that you're adding in. And, like just tell me where you see this kind of going in the future. What do
Yeah.
you plan on adding? And then obviously, like people want to get a hold of you. What's the best way to get a hold of you?
You bet, you bet. So, so we just released this new version. I'm very happy with it, and I was looking for feedback and stuff. The funny thing is that my programmer comes to me the other day and he goes, "I've got this great idea for a totally different graphical user face, different navigation scheme." I'm like, "We just released this. What do you mean?"
Well, he's the
He said, "Let me."
programmer. That's
Yeah, so let me.
why.
He says, "No, if I would have known that this was going to end up like this, and we would have done it from the beginning." All right. So he mocked it up, and then he put some programming together and showed me. And it's like, my wife and I reviewed it. It's like we got to do it. All right. So there's gonna be another user interface that we put on this thing, and it's really beautiful. It's really elegant, super intuitive. So that's one of the things. And then, we have leveraged the heck out of AI for a couple of years now and tried to look for ways. So any way that we can automate some of these tasks and take it off the desk, out of the hands of the doctor, and free them up a little bit more or the staff, we're going to do that. So, we leverage that in the care plan a great deal. And then also, we can, a lot of doctors use this stuff to market their practice. So they can grab links to the videos and post it, on their websites, social media sites. They can send this stuff to patients, and they can even schedule this stuff out as well, too. They can say, okay, now I've got this patient that dropped out of care. I mean, boy, they really need to understand, what's going on here and what could happen. So I'm going to go ahead and send them this and this, and then I'm going to have AI, because AI is going to say, okay, this is where this practice is. It's located. Go ahead and schedule. So it'll schedule to send out all those videos for that doctor or for that staff, and it'll send it out, and they could override it if they want to. So that's, again, another application of AI. The more of that we can put in there and make it smarter and easier for the doctor, more automated, the better.
Cool. And then how do they get like a trial or how do they get a hold of you and how do they test it out
Yeah,
and see how
We're,
it
we're putting
works?
together a trial version now, but usually what they do is they just reach out to us, 3dpractice.com, go to the calendar, schedule something with us, and we'll only need about a half an hour to go through it. We'll understand exactly how they practice. We'll be able to show them a lot of those, if they have cash-based services or whatever, or they focus on personal injury. By the way, there's one more thing I got to tell you. The doctor that brought me over to your booth at the FCA, Paul. Yeah. So Dr. Paul, he was telling me that he's been taking this, our personal injury content over to the courtroom and using it very effectively. And he says, I'm just killing the competition, the insurance company. They don't know what to do with me. I'm killing them. And then coincidentally, 30 minutes later, another doctor comes up to me, and I don't know his first name, but the doctor, and I was talking to somebody, I turned and he goes, we just won a $500,000 case using your product in a
Well,
courtroom.
they're communicating to a jury, right?
Yeah. And
It's
it's,
got to be
yeah,
simple, relatable, they get it, and
right.
they're visual.
Yeah, and it's technically very accurate too. So all these things, we do our research, like the personal injury, rear impact auto collision stuff. It all came from research, everything
Yeah,
that it shows. And we use a graphics engine so that the doctor can stop and turn it and look at it and point out this and that. And that's one of those applications where there's so many things going on that it's a good idea. But people can go to 3dpractice.com, just schedule 30 minutes. That's probably all they're going to need. We'll go through it. We'll understand exactly what their needs are, how they practice. And then they can make a decision. We always back it up though and say, look, there's a 30-day money back guarantee. If for some reason you don't like it, and then we'll also do an online training. They're built-in tutorials, and we've got some really good webinars with some doctors that talk about how to do report of findings as well too. But we want to make sure that they're off and running and successful. And I love hearing success stories, and that's what floats my boat.
that's cool. And yeah, I would have to say it's very user-friendly. The people I have using it, like they're not self-proclaimed tech wizards, and they're using it very easily. Like they know how to click a mouse, they know how to log in, and if you could do both of those things, that's all you have to do.
That's the challenge we have, right? It's got to be technically good, in depth, easy for the patient to understand, easy to navigate for the user.
Yeah, and anywhere they have internet. So it could be a
Right.
tablet, a desktop, a laptop,
Whatever they
anything.
have. Yeah, even on the television set. I mean, the new smart TVs with the browsers are getting so good. You can literally, we're able to bring it up on television sets with a remote control and navigate and play this and play that. No
Yeah,
computer involved whatsoever.
cool. Awesome.
Yeah,
Well, thanks for joining us and thanks for sharing.
you bet. Thanks for having me, Noda.
Take care.